Hello everybody, welcome to my page. I'm Dr. Sahara Mohammadipour, and in this video I will talk about drug interaction between a vaccine and the daily prescription that you have to use. I try to give you some point and I hope you will use it in the future before you take your vaccination. First of all, I have to say you, if you have to use daily prescription, don't worry because the vaccine could not reduce the effectiveness of your drug, and all the prescription that you take could be as effective after receiving your vaccine as they were before, and they could not interact together because they affect your body in a different pathway. The second point that I will mention is about aspirin. Some people ask me, is it possible to consult aspirin before vaccine because they think maybe the aspirin could reduce the heart attack of possible heart attack of vaccination. First of all, I have to emphasize the vaccine could not cause any heart attack. Please don't worry about it. Vaccines are the deactive virus, and deactive virus try to interact with your immune system. Okay, do not cause any heart attack or whatever you think. Okay, if you do not take aspirin before, don't take it now because of the vaccine, and just take it. But if you take your vaccination, but if you take aspirin as a daily prescription, you have to mention these 3 points. First, tell your doctor that you take an aspirin. Second, because aspirin, warfarin, or the other drugs that I will mention in this video cause dilute your blood, you have to know that maybe you experience a little more bruising and bleeding. Because of that, if it is possible, please eliminate one dose of your aspirin or whatever that you take before vaccination. After injection, just press the place of the injection for 5 minutes. That prohibition of more bruising or any bleeding. Totally, any drug that do not disrupt your immune system could take during vaccination, before it or after that. There is no problem and they could not interact together. The other question that I will answer is, does any medication cause decrease in vaccine effectiveness? The answer is yes. Unfortunately, the people who recently transplant or undergoing a chemotherapy or use autoimmune medication or any medication who relate to HIV virus, because all this drug and medication cause affect the immune system, you have to know that maybe the effectiveness of your vaccine reduced because of the drug that I mentioned. But don't worry, there is no side effect. I mean, the vaccine could not cause side effect for these special people because they use some special drugs. Don't worry. But maybe they could not be as effective as the other normal people who take the vaccine. But it's still better to take your vaccination. Okay. The third question I think is, does a vaccine cause allergic reaction to people? Totally, the vaccine could not cause allergic reaction because they are just deactive virus or mRNA. But the media that carry out the deactive virus in the vaccination, like polyethylene glutamate or polysorbonate, maybe cause their allergic reaction to some people. How can we understand that we have this allergic reaction or not? If you have any allergic reaction to the other vaccine that you took before, maybe it's better you tell your doctor and be more caution about taking vaccination. The fourth question is it possible to take vaccine, COVID-19 vaccine with the other vaccine that we need, like flu or influenza or whatever? The answer is yes. There is no doubt that these two vaccines could not interact together, but do not take them simultaneously and try to give a part between these two vaccination, and use a different part of your organ for take your vaccination, because if you had any allergic reaction, you could emphasize which one is cause allergic reaction for your body. And at the end, I will tell you, is it possible for people like me who had seasonal allergic or have any allergy or reaction to penicillin or antibiotic, is it possible for them to take vaccination? The answer is yes, but have some precaution. I mean, please take your vaccination in an area, in a place who had enough facility for helping you if you had any severe allergic reaction. At the end, I have to tell you, please don't use painkiller before your vaccine, because they reduce the effectiveness of vaccination. And if you had any side effect before vaccine, just use acetaminophen. Do not use any drug, any medication after your vaccination, because they could cause the reduction of immune system capability and vaccination efficacy. I hope this video could help you for answer all your questions. If you think this video could be helpful for the other person, please save it and share with the others. Have a good day. Goodbye.